Welcome to Health Bulletin. Get an in-depth look into how China's National Health Commission is stepping up efforts to address the recent increase in respiratory illnesses. China seeks more clinics to cope with surge of respiratory illnesses in children. China's top health body urged hospitals nationwide to extend service hours and set up more clinics, as the recent increase in respiratory illnesses drew global concerns. During a National Health Commission news conference, it was reported that pediatric hospitals are facing long queues. Some parents have reported waiting as long as 8 hours for their children to see a doctor, according to domestic media reports. Health officials have acknowledged the issue of overcrowded hospitals and, in an effort to alleviate public concerns, they have urged local clinics to increase their capacity to handle the rising number of patients. They are making all efforts to expand the number of relevant clinics and treatment areas, appropriately extend service hours. NHC spokesperson Mr. Feng informed reporters on November 26 about ensuring a robust supply of medications. Efforts are underway to establish epidemic prevention and control in crowded areas like schools are in progress, as well as in other childcare institutions and nursing homes. The Health Ministry reiterated its previous response to the WHO, attributing the recent spike in acute respiratory cases due to a combination of pathogens, with influenza being the most prominent. Wang Huaqing, China's CDC chief immunization expert, identified additional reasons for the rise in cases among 5 to 14-year-olds, including rhinovirus, common in colds, and Mycoplasma pneumoniae in younger children. Meanwhile, the SARS-CoV-2 virus, which causes COVID-19, is being detected among patients older than 60, according to Mr. Wang. The surge in infections is straining the country's health system. Meanwhile in Tianjin, medical staff at Tianjin Children's Hospital's outpatient and emergency departments reportedly handle 10,000 to 12,000 visits daily. Although health officials provided no data at the November 26 news conference, cases among children are notably prevalent in northern areas, especially in Beijing and Liaoning province, where hospitals are alerting the public about prolonged waiting times. At the same time, Hangzhou Hospital has summoned retired pediatricians back to work to manage the case surge, as reported by local government-backed media outlet Anorth on November 18. The health officials claim that Mycoplasma pneumoniae caused the recent spike is met with skepticism, as many residents report testing negative for it. A pediatrician in Beijing, identified as Wang Hua, who was also infected, expressed doubts about the nature of his illness as he mentioned to the Epoch Times. He said, "I suspect this is not Mycoplasma pneumonia because none of the drugs typically used for its treatment have worked." Some suspect that the country is grappling with the rebound in COVID-19 infections, as the infected showed similar symptoms, such as cough, fatigue, and white lung. At the core of the concerns is whether novel pathogens have emerged in the recent illnesses. A key purpose was to identify whether there have been clusters of undiagnosed pneumonia in Beijing and Liaoning as referred to in media reports, the WHO said in the statement. The WHO said it received the clinical information, laboratory results, and other data it requested on November 23. The United Nations Health Agency reported that the surge in respiratory illnesses in China appears to be related to the withdrawal from its almost 3-year zero-COVID policy. Chinese authorities advised that there has been no detection of any unusual or novel pathogens or unusual clinical presentations, according to the November 23 statement. Since 2003, when health experts accused Beijing of concealing the SARS epidemic, the Chinese Communist regime has faced global scrutiny for its outbreak reporting, which caused by a previously unknown virus believed to have emerged from the southern Guangdong province before it spread to major Chinese cities and nearly 30 countries. Since another virulent respiratory disease appeared in central Wuhan city in late 2019, health experts and officials worldwide have repeatedly questioned the accuracy of the country's data. Earlier this year, as a massive wave of COVID-19 overwhelmed hospitals and funeral homes following the sudden lifting of pandemic restrictions, the WHO once again appealed for transparency, stating that China's official tallies are underreporting the actual scale of the outbreak. A specialist WHO team daily reviews thousands of media and internal surveillance reports on global disease circulation. Experts then determine if additional information is needed to assess if it could become an international public health emergency. but it is unusual to announce the request for more information publicly. The UN agency is no doubt mindful that people might be more jumpy about viruses reported in China with the not-so-distant memory of COVID-19. The WHO is also trying to be more transparent in the aftermath of the pandemic. The UK's Health Security Agency said it was closely monitoring the situation. Last week the Chinese NHC said there had been a rise in several respiratory diseases across the country. In particular influenza, COVID-19, Mycoplasma pneumoniae, which is a common bacterial infection affecting younger children, and RSV. Officials attributed the rise to the lifting of COVID-19 restrictions. Other countries, including the UK and the US, saw similar surges in flu-like illnesses once pandemic restrictions were lifted. Infectious disease expert from London Genetics Institute suggests that China is likely facing a significant wave of childhood respiratory infections this winter. This is the first winter following their extensive lockdown, which likely reduced the circulation of respiratory viruses and decreased immunity to endemic bugs. Many health experts said at present there was too little information to make a definitive diagnosis of what was causing the infections. But they believe this does not sound like an epidemic due to a novel virus. If it was, we would expect to see many more infections in adults. The few infections reported in adults suggest existing immunity from a prior exposure.
Thanks for watching.